Hello, welcome again to another edition of Manners of the Heart, brought to you by Haverhill Community Television and Pentucket Medical Cardiology. I'm Seth Bilazarian, and with me today again in the usual spot is my associate, Dr. Sunny Srivastava. Dr. Srivastava is going to talk about a common medical problem that may have some cardiovascular implications, but is primarily not a cardiac or heart-related problem, but it is very problematic for many of our senior patients, and that's the problem of gout and the associated problems that come about from the chemical that causes gout called uric acid, and the problem is called hyperuricemia, an elevation of this chemical that causes gout. So I'll ask Dr. Srivastava to take this away and give us his thoughts about gout and what it's all about.
Great, thank you. As you alluded to, it may seem a little odd that we're talking about gout, which is a type of arthritis, but what really prompted me to want to talk about it was that just in the past week, I had 3 or 4 patients in the office with gout, and it's quite common in the cardiovascular population. And so as a result, it made me really want to think about it more and talk about it and just raise some awareness about it. And so what it is, just what I said, it's an arthritis. It's a complex form of arthritis. It's really characterized by the very sudden, sharp onset of pain, redness and tenderness in a joint. And the joint we think of as being the most commonly affected one is at the base of the big toe. That's the most common one we hear about. It can affect anybody, men, women, but it tends to be more men than women until menopause strikes, and then after that, the susceptibility in women really approaches that of men. We can talk later about why that is. And the hallmarks of this is that it can wake you up in the middle of the night. It actually, more often than not, occurs in the middle of the night. It's sudden, with no real creeping up on you type of phenomenon there. The joint that's affected, often the toe, as I said, it's hot, it's red, it's swollen, it's tender. It's so tender that even having the sheets touch it lightly, just a sheet touch it, can send you through the roof. I thought, and I can remember in medical school talking to people, some different famous people who've had gout. And Thomas Jefferson's a very common person who's referenced, as is Benjamin Franklin or King Henry VIII. Some real popular, or not popular, but famous people in history who talked very publicly about their problems with gout. So it's been known about for a long, long time. It's pretty common. Somewhere between 2 and 2.5 million Americans are affected by it, and so worldwide it's a much larger problem, obviously, but certainly very, very common.
Very good. So tell us a little bit more about it. What causes it?
Yeah, so well, before I even get to the causes of the symptoms, well, I think we've mostly talked about the symptoms. Like I said, the sudden, the pain, et cetera, and usually the pain is at its worst for the first day, 12 to 24 hours. That's the peak of the pain, excruciating, exquisite pain, really unbearable. And then certainly with treatment that diminishes and can linger in a lesser degree for a few days. But what causes it is, as you referred to in the introduction here, is this chemical called uric acid, or urate is another way you can refer to it as, but uric acid crystals. And uric acid is a substance that's in your bloodstream ordinarily, but when you have high levels of uric acid in your bloodstream, it can deposit or accumulate around the joint and thus cause inflammation and pain. And these uric acid, they're crystals. When you look at it under a microscope, as we've done in medical school or training or what have you, they're crystals, and they're very, very prominent look to them. It's painful. And what the uric acid comes from is a substance called a purine, and you eat this, you ingest it. It comes in certain types of organ meats, certain types of vegetables, a lot of different things that we can get into. Your body breaks that down, and purine and uric acid is one of the results of that, and it can build up in your system. And like I said, ordinarily, your body I didn't actually even say this, but ordinarily your body processes it, takes care of it, and you urinate it out through the kidneys, and no problem. And some people who may consume too much of this stuff and cause high levels of it, other people, your body overproduces it, or your kidneys may not be very good at excreting it, and that can lead to the high levels, and thus the formation of these sharp crystals and accumulation around the joints.
Well, I appreciate what you said so far, but I'm a little confused because you're telling me now there's 2 to 2.5 million people in the United States that are eating organ meats. Is that what you're telling me?
No.
Organ meats meaning like liver or kidney or brain. Is that what people are doing?
That's
how this is happening?
No, definitely not. But that is part of it. But right, correct. Obviously, That is not a very popular thing to eat, but that is certainly part of it. There are certainly other foods and drinks, so that's the other piece of this puzzle. So alcohol and beer, quite a bit. So that's a big driver of this. There are certain types of cheeses that are drivers of this. Other types of foods, dried vegetables, mushrooms, spinach, asparagus, so things that are more commonly eaten can lead to it as well.
Okay. So should we talk a little bit more about other causes or just focus on the diet? Because I'm fascinated by this diet thing because I have patients, I even have family members who have asked me about, how do I avoid this? And I certainly know about the beer and I know about organ meats. I encourage sort of just less red meat in general.
Yeah, right.
But what other things can we encourage patients to do, or should we talk about other causes first?
Yeah, I mean, the risk factors, just certain who's at risk for getting this.
Sure.
And so certainly people who are indulgent in what we just talked about, that plays a major role. Obesity in and of itself, which may be the result of indulging in those types of things, plays a role. Having other medical conditions such as diabetes, high blood pressure, high cholesterol, congestive heart failure, coronary artery disease, blockages in the arteries of the heart, you are at increased risk for having gout. And it's a very complicated relationship here with all these things. You don't know which chicken and egg phenomenon, or are you more when you have coronary artery disease, you often more likely have high blood pressure, high cholesterol, diabetes as well. So it's hard to say what the exact relationship is. These things all tend to travel together. There's certain medicines that one could be taking. We commonly treat patients with types of diuretics. One common one is hydrochlorothiazide, a thiazide type of diuretic, and that's associated with raising levels of uric acid. And so that is a very common cause of gout. Aspirin, even. Aspirin is something that can cause higher levels of uric acid. I wouldn't call it necessarily a really common cause of gout. Millions upon millions of people take aspirin, but it certainly raises uric acid levels. People who have had transplants and take medications to prevent rejection of their transplanted organ, some of those medicines can cause an increase in uric acid as well. There's a higher risk in people who've had a strong family history of gout. That plays a role. And some of those reasons are probably pretty complicated from a genetic standpoint. Men versus women we talked about. Men certainly at higher risk than women, and things change after menopause. As with a lot of these disease states, after menopause, things often equalize more so. So I think that kind of encompasses who's at risk for it. But yes, in addition to the diet and the food and the lifestyle stuff.
Okay. So, you get gout, it hurts. You said it lasts worse for 12 hours, goes away after a couple of days. So what's the big deal? I mean, it hurts, but other than that, any other problems can happen? Any complications with this?
Well, first, some people may never have it again, or
that would
very
be good.
Or very rare, a few times in their lifetime.
Okay.
Especially if they make some lifestyle modifications. But then, of course, there are people with recurrent gout, and that's a quote-unquote complication, recurrent gout, because ultimately, if left untreated or not taken care of, can lead to deformity of joints, certainly. There's something called tophi, which are really just deposits of the uric acid crystals that can form. People get them around their ears sometimes, or on their joints specifically, and they themselves are not tender, but they're like little bumps or nodules that can develop, and that's not desirable. And one interesting complication is kidney stones. People with high uric acid levels and with gout can have uric acid stones as for kidney stones. And obviously, I think it goes without saying that kidney stones is an undesirable complication, especially for those who've had them. It's an undesirable complication.
Okay, so it's quite painful. Okay. Yeah. So how do you make this diagnosis? I mean, you said that you get a big red, swollen, big toe.
Yeah.
And the sheet hurts it.
Yeah.
Is that the diagnosis right there? Or?
Truth be told, you could certainly make the diagnosis just clinically. But there are, in some patients who have other complicated medical issues, there might be other things that you might be thinking about. So the real gold standard way to diagnose it is to actually sample the fluid that's there. So what that means is put a needle in there and draw out the fluid. That sounds horrible, having a needle stuck right into the joint at the base of your toe, but it's the way of drawing the fluid out. And same thing if your knee. Your knee's a little bit easier to draw fluid out of, but you can draw fluid out of there. And what you do is you look at it under the microscope and look for these telltale crystals, the sign of it. And if you see that there, then you certainly have the diagnosis. You can check blood tests for uric acid as well, and that's a little deceiving. Just having a high uric acid level in and of itself does not mean you have gout by any means. Conversely, you can have gout clinically and have a low uric acid level, and that doesn't exclude the diagnosis of gout either. There can be very quick, rapid shifts in the level of uric acid that you have during gouty flares. That's what the phrase we use. So that's a little deceiving, but certainly part of the testing.
Okay. All right, so the patient has these symptoms of concern, patient or family member, has the red toe, suddenly came on, sheet hurts it, they maybe get this needle stuck in there and some fluid taken out and the diagnosis is made. So now what? How do you treat this problem?
Yeah, so there's like a lot of conditions, there are multiple tiers to treatment and different ways you can handle it. The most simple and easiest treatment are very routine, over-the-counter or prescription strength, non-steroidal anti-inflammatory drugs, NSAIDs, we refer to them as. Some common names for these are the Motrins, the Advils, ibuprofens, the Leaves of the world. One prescription one that we often use is something called Indocin. It's a common one to use. So that works in some people, not everybody, but in many people that works. If that doesn't work.
Work means that like it takes the pain away and the joint becomes less swollen. Is that what you mean?
Correct.
Okay.
Yeah, I would not. I don't want to make this statement or make it. It's not the best agent to prevent recurrence or suppress it by any means.
But it gets rid of the problem when
the acute problem. Yeah, and in many people, it's not quite potent enough or strong enough or good enough, especially in folks who are prone to recurrent attacks. It may not be the drug of choice. Some people can't take that class of medicines for a variety of reasons. And so we use other medications. One that's commonly used is something called Colchicine. And that's another medication that's specifically really just used to reduce gout pain. I don't know if maybe you do, of too many other uses for Colchicine. Do you use it for anything else?
There is one other thing. There's a peritonitis related to Mediterranean fevers.
Oh,
that
boy.
supposedly that's
Okay.
that's a medical trivia.
That's a medical trivia that I
That's
forget,
right.
certainly. And Colchicine is effective, and the way you know you've taken enough, really, is when you start to develop diarrhea. Diarrhea is not an allergy to the medicine. It's a known effect from the medicine, and that sort of tells you you're at the right. It's a strange way to find out that you're taking the right amount, but that's effective.
Why is that better than just say take 2 or 3 times a day to try to get rid of
Well,
it?
you might not be getting enough to get the job done is one thing. So you can take it more frequently to get rid of the discomfort. But when you start having the diarrhea, it's time to stop, basically.
Okay. So you stop or you just cut back?
Well, you cut back. Sorry, yeah. I mean, I meant stop ramping it up and stop taking it so much. And then some docs may recommend that you take a low-dose daily colchicine going forward if you're one who's prone to recurrent attacks. It is one strategy of helping prevent future attacks of gout.
Okay.
For the acute phase of this, when you're in the throes of the pain, and if these types of measures haven't worked, there is one last tier of medications, steroids or corticosteroids. We generally like to avoid.
So that's a medicine like something called prednisone?
Prednisone, or you could even get a shot right into the joint as well.
Okay.
But prednisone, right. And we like to try to avoid steroid use if we can, because steroids, if used over the long term, have a lot of bad side effects. They thin out your skin, easy bruising, your immune system's weakened, weight gain, fluid retention, a lot of undesirable side effects. And so we like to avoid prednisone if possible. The general thing is that we just do a quick, short course of this for a few days, and so these side effects don't tend to be an issue. And same thing with when putting it into the joint with an injection. It's not so much an issue. We certainly don't like to have people take it over the long term to prevent gout by any means. That's not a strategy with steroids. And so those are the 3 things you generally use: the anti-inflammatories or NSAIDs, the colchicine, and the steroids. Those are some of the 3 mainstays of treatment during the acute phase of gout, when it's really driving you crazy. The next.
How long does it generally last if you get one of these treatments? Guessing, is it usually a 3-day affair or a 5-day affair?
Often there's a common 5-day pack of steroids that people often take to quickly taper off of them and take care of the problem. So that's one reasonable thing, or 3 days as well.
Okay.
Now you want to try to prevent it from happening again, certainly. And there's a couple ways to get at that. There are medications that block the body's production of uric acid. One of these common medications is allopurinol. Many people take it. And it essentially limits the amount of uric acid your body makes, and it lowers the level. one caveat to this is that if you give it to somebody who is in the throes of an actual acute flare of gout, right in the middle of it, that prompt shift in uric acid levels can actually exacerbate or make things worse. So you don't want to give allopurinol right off the bat if someone's in the middle of things. You wait till it calms down.
So it's not good
down.
for the acute,
Correct.
but it can be good for prevention.
Correct.
Okay.
And there's side effects of that. There's a certain type of skin rash that people rarely get with it that's important for doctors to be notified about. And like any medicine, you can have nausea with it and what have you. And there's some things you got to be careful with in patients who have kidney disease, for example, and how you dose it. But by and large, it's a pretty well-tolerated medication and fairly good at preventing gout. And some people, and you can actually do tests to figure out, are you, as an individual, someone who is an overproducer of uric acid?
Making too much?
Correct.
Okay.
Or are you an under-excreter? Are your kidneys not allowing you to pee it out?
Okay.
Yeah. So, and you can do tests on the urine to check and figure that out. And probably, truth be told, underutilize those tests.
So if you are an overmaker, then you'd be on the type of medicine that would stop you from making it as much.
And if you are
that's the allopurinol type
correct.
stuff.
And there's some other ones that are being looked at as well, but by and large, just allopurinol is a simple one to think about. The under-excreters, it's a problem with the kidneys. There's a medication called probenecid that helps your kidneys excrete it. And so the treatment really changes based on what your kidneys are doing and how effective they are at clearing uric acid, or if you're an overproducer of the uric acid. So that's another medication that people use. And though I don't see it as commonly used as allopurinol, I assume that's your experience as well.
Yes.
Yeah, that allopurinol is probably the more common one used.
Okay.
So that's, I think that's sort of the mainstay in medications or medical treatment that, just to reiterate, for the acute flare, you're middle of the night, you're woken up in miserable pain, either NSAIDs, Motrin, Advil, Aleve, ibuprofen or Indocin, or colchicine, or steroids. Those are the three things. And it can be in the joint, an injection, or pills. And usually most people just take some pills for this. And then there's the long-term prevention with either colchicine on a low dose, allopurinol, or the probenecid we talked about.
Okay. So one of the things that we've done, I think, fairly well on our show Matters of the Heart is talk about preventative strategies for other areas. Can we talk a little bit about what a patient who has this problem can do for themselves to prevent these episodes from coming on? You mentioned the organ meats. So
yes.
Don't eat liver, but there's got to be some other things that we can do.
Yeah, there's actually even more, most people around from these parts are not eating liver or pancreas or thymus or anything like that, and so that's usually not an issue.
So what can they do?
But one simple, so a couple of simple things that the American Diabetic Association recommends is drinking a large amount of fluid per day to stay hydrated, and if you think about it, essentially dilute the uric acid. This might be a simple way of thinking about it. And it's a lot, 8 to 16 cups of fluid per day, preferably water, for a large part of it, and avoiding alcohol. So, when you tell people to drink heavily, not alcohol. Alcohol is a problem for this. So avoiding alcohol, drinking a lot of fluids, and really picking and choosing the proper types of protein. So you made a reference to red meat. So avoiding red meat and really limiting your daily intake of proteins in general, maybe having better choices of proteins, whether it's tofu or not, different types of things, but avoiding some of the red meats. There are also a lot of alternative treatments that are out there that I think less is known about them, certainly, but a lot of people, go on the web and type in gout and go looking and come up with a zillion different things that you could take or try. And a caveat about these things, and there's a lot of remedies sold to people directly online. None of these things have really been studied. There's not a lot of safety in these things or oversight and such, so I'd caution people on that. There are a lot of other simpler things that people think about. So one is coffee. So coffee, it's definitively known that coffee, whether it's caffeinated, decaffeinated, can lead to lower uric acid levels. What's not known, and it's never really been looked at, is does that actually have any effect on gout? That just incidentally you can find that coffee lowers uric acid, and that's nice to know. But it's never really been looked at as far as a treatment or a strategy in people with gout. And And so if you're a non-coffee drinker, I'm not sure any of us could recommend that you suddenly become a coffee drinker as a preventative strategy. Vitamin C, same type of thing. That vitamin C supplements are known to reduce the levels of uric acid. And the same statement that persists that I can't recommend necessarily as a treatment for gout, but it's interesting to note that vitamin C supplementation can lead to lower uric acid levels. And I think it's always important to caution people to not take mega doses of vitamin C. Some people think it's fine, just keep popping vitamin C's and you're fine, but you can take too much vitamin C and that's a problem as well. Another one that people really talk about is cherries or cherry juice. And other types of berries, whether it's dark colored berries such as blackberries or blueberries or raspberries, can lower levels of uric acid as well. But it's not just like the other things I talked about. It's not clear that there's any effect on gout signs or symptoms either. So those are some of the sort of complementary things that people can do. There are, as I mentioned on the web, for example, if you go, there's all sorts of products people are selling that they claim to be our great gout treatment, and I just can't necessarily promote or recommend those by any means.
Okay. So is there anything else that you might be able to help us in terms of the whole prevention realm that you feel like you want to encourage either patients who may be at risk for gout because they know a family member has had gout, or maybe they had some attack in the past and are concerned about having it again?
Yeah, I mean, it's very similar to a lot of the things we tell people when you're trying to treat or prevent heart disease. And it sounds, just sort of general healthy lifestyle, diet, exercise, maintaining a good weight, treating other conditions like the blood pressure and cholesterol and diabetes and keeping all those things in good check certainly makes a difference. And then despite all those things and you're doing all the right things and you're still prone to getting gout, then some of these preventative measures that we talked about, such as you could take a low dose NSAID every day. Although that's not really the greatest way to prevent gout. You could take colchicine on a low dose every day, or allopurinol or probenecid, depending on what your condition is. The dietary changes we talked about, copious amount of fluid intake, a lot of water, avoiding alcohol, avoiding specifically beer is the one that's thought of to be the bigger issue. Eating a balanced diet, emphasizing fruits and vegetables and grains and fat-free and low-fat products, and other foods. I think I have a list here written in front of me, but other foods, mushrooms, spinach, asparagus, cauliflower. Avoiding some of those are pretty good things to do. Getting your protein from low-fat dairy products may have actually a protective effect against gout. So those are your best bet protein sources. Limiting your intake of red meat or meat in general, and fish and poultry plays a role as well. And as I mentioned, maintaining a desirable weight and a healthy lifestyle with exercise. I think those are probably some of the most simplest preventative things to talk about. And again, it seems a little odd that we're talking about gout on a cardiology program, but really I see it all, as I'm sure you do too. We see it all the time in our patients who have, all of our patients have high blood pressure or high cholesterol or diabetes, congestive heart failure, and so we see it all the time. And so figuring that our viewing population, many of them I'm sure have gout, and thought it would be something interesting or different to talk about. And actually I mentioned congestive heart failure, and there is a lot of evidence to suggest that folks with congestive heart failure not only are more prone to having gout, but it also may be a sign of perhaps being at higher risk for a bad outcome with your congestive heart failure. And so all the more reason to get on top of it and treat it and be aware of it, certainly.
Very good. Well, I certainly appreciate it. I guess the message that I'm hearing you say is that this is a common problem, particularly a common problem in patients who also have cardiovascular problems or at risk for cardiovascular problems like weight and whatnot, weight problems or other medical problems, and that the things we've talked about in this program before about a healthy lifestyle in terms of keeping weight down with exercise and proper diet and limiting the amount of animal fats and drinking plenty of fluids are things that would be effective for this problem as well.
It's effective for everything. Really, you can give that advice for almost anything.
But we don't want to say that because we won't be able to do any more shows here if we don't. So we have to say it
all
each
boils
time.
down to just exercise, eat right, and
Isn't there something easier though, Dr. Sonny?
No, there's no magic pill.
Okay.
So.
All right.
So,
well, maybe next time we will.
Yeah, and I think that wraps up what we talked about here. We went through what gout is, who gets it, why do you get it, and how you treat it, and how you prevent it.
Great.
So hopefully that provided some
Great. I thought it was
assistance,
a wonderful review. I have frequently been asked about decision-making about treatment and prevention strategies by patients and also by family members, and I thought that was a really wonderful review that Dr. Srivastawa provided for us this week. So until next time, I'm Seth Bilazarian from Haverhill Community Television and from Pentucket Medical Associates Cardiology. We'll see you next time here, and thank you for joining us again on this edition of Matters of the Heart. Thanks.